Okay, so this is my first video, and this video is about RAAS system. The full form of RAAS is renin-angiotensin-aldosterone system, and it has many components. So let me first enumerate the components of it. So the cells, so there are JG cells in the kidney that secrete pre-prorenin. Pre-prorenin is converted into prorenin. Prorenin is converted into renin. This renin acts on the angiotensinogen that is secreted by the liver to convert it into angiotensin 1. Angiotensin 1 is converted by angiotensin converting enzyme into angiotensin 2, and angiotensin 2 is converted by angiotensinase into angiotensin 3, which further gets degraded into angiotensin 4. Okay, now let me describe some of the important points regarding these. So JD cells are modified smooth muscle cells in the kidney, okay, जो कि that are located in the afferent arteriole that are proximal to glomerulus, and that is macula densa cells that is part of DCT that sense sodium and water concentration. So they together, JD cells and macula densa together are called juxtaglomerular apparatus. Okay, now the renin concentration is inversely proportional to the sodium chloride concentration in DCT. Okay, so more the sodium chloride concentration, less is the renin. Okay, now the stimulus for JD cells to release renin is decrease in BP. So if BP due to any mechanism like dehydration, hemorrhage, if BP decreases, renin gets secreted. Okay, renin has a half-life of 30 minutes to 1 hour. Renin is basically a proteolytic enzyme, actually aspartyl protease, and angiotensinogen is a gamma alpha 2 globulin that is secreted by the liver. Now it is there are so many stimulus to secrete angiotensinogen like glucocorticoid, thyroid hormone, estrogen, cytokines, angiotensin 2. So it has implication. Okay, so there is HRT, hormone replacement therapy, in which we give estrogen parenterally, which causes parenterally or enterally we give estrogen and together with progesterone. So estrogen causes increased secretion of angiotensinogen that cause hypertension. Okay, angiotensin 1 is the 10 amino acid peptide that is a globulin, and angiotensin 2 is 8 amino acid it has a very short half life, but 1 to 2 minutes, but very potent actually. Angiotensin 3 and 4 also have action like angiotensin 2. Okay, now angiotensinase is present in RBC and soft tissues. There is some trapping of angiotensin 2 also happens in blood vessels other than the lung. Okay, so now what are the functions of angiotensin 2? The function of angiotensin 2 is vasoconstriction, and it is more in arteriole because there are more receptors. Okay, so what is the end effect? End effect is increase in TPR, increase in venous return. All they will cause is increase in BP, increase in cardiac output, and so on. Okay, now it a direct vasoconstrictor, retains salt and water. Okay, since it retains salt and water, how it retains salt and water? Actually, it directly act on the kidney. It acts on, it constricts renal vessels, so there will be slow flow of blood in peritubular capillaries. So slow flow of blood will cause rapid sodium and water absorption. Okay, and it stimulates adrenal glands to release aldosterone, which cause sodium and water retention. And remember, the potent action is, the direct action is more potent, more potent. Okay, and angiotensin 2 facilitate norepinephrine release from the postganglionic sympathetic fibers. Angiotensin 2 cause contraction of mesangial cells that will decrease in GFR, that is more sodium and water absorption. It acts on the brain to decrease sensitivity to baroreceptors reflex, increase water intake, increase vasopressin, increase ACTH. Increase ACTH means increase cortisol. Okay, so all the mechanism will increase the BP. So what is the effect? Sodium and water retention cause extracellular fluid volume expansion, that was increased arterial blood pressure. Now the significance of RAAS. There are many significance of RAAS. A person can eat variable amount of salt in his diet because of this, but BP will be maintained. Suppose so much a person ate so much of salt, that will increase BP, that will decrease RAAS. And suppose if a person has a less amount of salt, that will decrease BP, but that will increase RAAS. But that, so RAAS system will be activated and it will maintain BP in the long run. Okay. And there are types of RAAS: somatic RAAS, germinal RAAS, and local RAAS or tissue RAAS. So germinal RAAS is present in postmeiotic spermatogonic cells, spermatozoa. Its inhibition causes decreased fertility in male. And local RAAS is present in so many tissues. One example is angiotensin 2 is a growth factor in hardened blood vessels. So angiotensin 2 is implicated in the cardiac myopathy and hypertension and so many pathologies. Now there are some important points. Remember, prorenin is secreted by other organs, but renin is secreted by the almost only by kidney. Okay, so renin is secreted by the kidney, but prorenin is produced by other tissues also, that is like local RAAS. Pressor activity is decreased in angiotensin and sodium depleted and cirrhotics. That is common sense. If a person is cirrhotic, its protein synthesizing capability is very low, so he can't synthesize angiotensinogen, so angiotensin 2 will not form. If a person is sodium depleted, how will he absorb sodium and water? That is the end effect of angiotensin 2. Okay. Now factors increasing renin activity. Sympathetic activity in renal nerves, beta 1 on JG cells, circulating catecholamines, prostaglandins, all they will cause increased renin activity. Now decrease renin activity. Sodium chloride, increased sodium chloride absorption in macula densa, increased afferent arterial pressure, angiotensin 2, vasopressin, sodium depletion, diuretics, hypotension, upright posture, dehydration, cardiac failure, cirrhosis, constriction of renal arteria, artery or aorta, and psychogenic stimuli. So the mechanism behind all this, sodium chloride absorption is sensed by macula densa cells, and afferent arterial pressure, if increases, that will decrease sodium chloride delivery, decrease sodium chloride increased afferent arteriolar pressure will cause increased sodium chloride delivery to macula densa. Increased sodium chloride delivery to macula densa will decrease renin. Angiotensin 2 feedback inhibition and vasopressin feedback inhibition. Increased renin, sodium depleted will decrease BP, so increase renin. Diuretics, hypertension, dehydration, all because decrease in BP. Cardiac heart failure will cause decrease in BP. Cirrhotics have decreased angiotensinogen 1, so that will reflexly increase renin. And upright posture, there is venous pooling of blood in lower limbs, that was decrease in BP.